Hello, my name is Kendall Bynum.
And I'm Joshua Summer.
Today we are excited to introduce you to our Prescription for Service project. Thank you for listening. RX Clarity is a student-led, community-based initiative designed to reduce medication harm caused by polypharmacy and improve health equity for underserved populations.
Imagine you're taking 8 medications from 3 different doctors, and no one ever really reviews whether they should all be taken together. For many patients, this isn't hypothetical, this is a daily reality.
Polypharmacy refers to the use of multiple medications, often five or more. While sometimes necessary, it increases the risk for dangerous interactions, side effects, non-adherence, and unnecessary hospital visits.
According to a statewide Georgia prescription analysis, more than 7,600 polypharmacy cases were reviewed. A significant number showed potentially unsafe prescribing patterns, confirming that medication risk already exists in this state.
Medication-related harm is a major cause of emergency department visits and hospitalizations, and many of these events are preventable.
Underserved populations face the highest risk of medication harm, not because of choice, but because of limited access to consistent healthcare. We hope RX Clarity will target these structural gaps.
Although statewide data does exist, Athens lacks publicly reported data on polypharmacy. This means that medication harm is occurring, but it's not being measured.
And this is what leads us to introducing RX Clarity. RX Clarity will be a student-led community medication safety initiative where the potential outcome of preventing harm before hospitalization.
RX Clarity is a community-based medication safety initiative led by student pharmacists that provide free medication reviews, patient education, risk screening, resource referral, and local data tracking.
RX Clarity uses a structured pharmacist-guided workflow to reduce medication-related risk. Patients complete a brief intake and medication review, including prescriptions, over-the-counter products, and supplements. Each patient is then assigned a risk level based on the medication burden. Moderate risk will be assigned for 5 to 9 medications, and high risk for 10 or more. We will then scan for dangerous interactions, duplicate therapies, and high risk medications under a pharmacist's supervision. Patients receive personalized counseling and then referrals are made when needed. Every encounter is documented to generate local data and guide future outreach. Arts Clarity will deliver targeted data driven care to these patients who need it most.
How will the $2,500 be used? It will mostly be used for these things, which include patient education materials, event supplies, outreach kits, printing costs, and data collection materials. Every dollar will directly support community outreach and patient care.
Measuring our impact. We will measure impact through both patient outcomes and community insight. We will track the number of patients served, medications reviewed, and risk identified, including, drug interactions and duplicate therapies. We will also document referrals to clinics and healthcare providers to measure how RX Clarity improved access to care. Finally, we will analyze our data to identify trends in medication burden within our community. This ensures RX Clarity creates measurable change, and not just meaningful experiences.
RX Clarity transforms confusion into safety and safety into equity. Thank you so much for listening today, and we hope to hear back from y'all soon.